Hi YouTube, this is Billie Jean. I'm giving you I was supposed to actually update my video yesterday as far as the pre-op class and the, the pre-op testing. Well, I did a short video, which I'm going to load before this one. The pre-op testing was pretty much blood work and x-ray of your chest, EKGs, arms, heart, and legs, which is why I told y'all to wear loose clothing you can take off so that they could put the sticky things on your legs, your shins. And a conversation with the anesthesiologist. The anesthesiologist pretty much lets you know that there are multiple ways to put a tube in your throat, and which you probably will need. 99.9% of the time people get that because the machine is breathing for you so that they can monitor your breathing while the carbon dioxide that they pump in your stomach during the laparoscopic surgery, you can't breathe on your own with gas being put in you. So they breathe for you pretty much and monitor your breathing that way, pretty much controlling it. So they can tube in your throat while you're heavily sedated and you're kind of like swallowing it. And he said it's the size of your pinky, which is my pinky is like this. His pinky is bigger than my pinky. Or you could just do it while the person is totally asleep. I told him I'd rather do it while I'm totally asleep so that I don't have any issues not letting him do it. Because if you never know how somebody is when they're sedated, they may cooperate, they may bug out. You never know. So that was a conversation with the anesthesiologist. Then I got the chest x-ray, and then I went to the class. The class is very informative. It's a 2-part class, 2 hours. The first part of it is basically the person doing all the medical stuff with you. They talk about the, in the hospital I'm at, they don't give you the blood thinner shots to go home with to do during the week. They give you a heparin shot of 5,000 milligrams one time before your surgery to thin your blood. And I guess that's supposed to last you throughout a couple of days so that you don't have to take it home. In my hospital, they do Steri-strips. They don't suture you. They do Steri-strips, and they take about 2 weeks to fall off, and you can't peel them off. They have to just fall off by themselves, and that will take care of your scars. Good thing I spoke to my surgeon this morning because I brought up this topic to the coordinator at the class that I would like the single incision because I had a tummy tuck already and my stomach is beautiful and I don't want any scars on it. So, you know, the 72-hour rule that your surgeon is supposed to give you a call back once you request to speak to them. My surgeon called me back the same day and said, you can have that single incision surgery if you want. Just let me know the day of surgery so we can put out the proper tools. And I said, I'm so happy for that because I didn't want any marks all over my stomach. So that was it. They put the IV in first, and then they put the tube in your throat. They put the catheter in while you're sleeping. They take it out while you're awake. They said it's painful when they take it out, but it's like uncomfortable. It's not so much painful. As long as, to me, if you're a little bit sedated, maybe that wouldn't hurt. But I would actually be sedated before they take it out because I've never had a catheter in my vagina before. So I don't know how I'm going to take that situation. Okay, with the gastric sleeve, which is what I'm getting, it's the mandatory 2-night stay. You get pain meds, which is a morphine drip every 2 hours that you control, and no matter how many times you press the button, you only get one. You can alternate morphine for something else if you don't like morphine. They give you 5 days of pain meds, which is usually Vicodin. I can't take Vicodin because I get sick and throw up. So they said, oh, you can have the alternate to Vicodin, not a problem. So I said, okay, that'll work. They also suggested the biotin nail and hair vitamin, which is like a B7 vitamin. So that, because a lot of times the gastric bypass individuals lose their hair more out of any of the 3 surgeries. So they suggested that if you want it. But discharge instructions after the gastric sleeve is pretty much the Protanox 40 milligrams tablet. You take 1 tablet a day. The chewable multivitamin. You take the chewable for the first, I guess, month. And then the second month you go straight into regular tablets and you swallow them. There's no more chewable stuff. Chewables is just for the sensitivity of your stomach. And if you are on any medications, what the doctor gives you, high blood pressure, diabetes, whatever the case may be, you continue that after the surgery as well. You can't take any surgery that's going to inflame you, like aspirin or BC powder, which I love for headaches. Anything you take has to be Tylenol for pain meds. And they only give you 5 days worth of pain meds because they are controlled substances. So from there on, you should be taking Tylenol extra strength or sleeping as a hobby because they don't want you to become an addict. I gave you a bunch of numbers to call in case you have any problems with the dietitian, of course the surgeon, the secretary's office, and the coordinator as well. They gave you a bariatric surgery pre-op instructions, which is basically the medications to avoid. You do the 2-day liquid diet. First you do the 30-day protein diet, of course. And then you do a 2-day liquid diet 2 days before the surgery. Liquid diet is basically broth, sugar-free juice, sugar-free jello, decaffeinated tea, the stuff you can see through, decaffeinated coffee, and a protein shake. You do that for the whole 2 days. No solid food, because the solid food may then turn into feces in your colon or in your stomach, and you don't want to end up vomiting any of that while they're doing all of their stuff while they're in you. So they try to clear you. The day before the surgery, by 12 p.m., the day prior to your surgery, you have to drink a half a bottle of citrate of magnesia, which is like Citroma, to flush yourself out so you have no issues with backlog. So that's how that goes. It was multiple questions about a medication to obtain. Their main thing is a multivitamin, an acid blocker, which could be Gas-X. Acid blocker, and they do want you to get Gas-X. Acid blocker, I guess, could be like Prevacid, I think it's called, something like that. So you can get that, but you don't start your iron. People that's taking the gastric bypass, they don't start the iron for a month, but they didn't suggest that any lap band or VSG patients take iron unless you have to by your doctor. The birth control thing was a major conversation because they don't want you to get pregnant for 2 years after you give birth. 2 years after you have a surgery. However, someone in the class said that the doctor, her GYN, told her she can't take birth control until 6 months after the surgery. That's, I don't know. Maybe the pill you can't take. Maybe the hormonal changes as long as your stomach and somebody needs to settle in as a new stomach first. I'm unsure. I just think abstinence and condom usage and you're wanting to be thin and beautiful all over again or for the first time should be enough birth control for you not to get pregnant. Now, if you happen to get pregnant, you have a big decision to make. You're just trying to lose all of this weight and you're just going to become a fat ass again. Pardon my French, but I think that if you're trying to make a change in your life, you don't need to add yet another traumatic experience to your body so soon. You should respect the fact that your body needs time to heal and that your brain and your soul needs time to heal. This is an emotional roller coaster. You cannot accept all of these fluster of emotions so fast, So I think ladies, really need to think about that. Really need to be on their best behavior and monitor that. They also did say no sex for 30 days after the surgery. Can we say oral? For him to you, of course. Anyway, what else did they give me? Consent for a disclosure and informed consent to say that you know everything that's going on. You sign that, you give your clearance letter from your medical doctor, especially if you have GHI, and that takes care of that. The day of surgery, if you're going to go for the single incision and your surgeon approves it, then you sign a consent form that morning to say that you want the single incision. It's an incision through your belly button. You put a big port like this with 3 holes in it so that they can stick 3 ports in those 3 holes. Your belly button really gets stretched to about that size. And then they put the cameras and all this other juicy stuff in there. And they use an instrument called the spider. And that instrument gets to the bottom of the situation. But it's beautiful after that. It's fine. You can have a horizontal cut or a vertical cut. I don't know, I don't care. But this stomach, this nice flat stomach, you will not tarnish. So, for the most part, I think that's it. I hope I was brief. I can't think of anything else to go over. I have my little list here. But just keep in mind, you need to get 4-ounce medicine drinkable cups, like those NyQuil cups, or 4-ounce cups. You need those because you're going to be drinking 4 ounces pretty much every hour for 12 hours. So that's the goal. Before you leave the hospital, you need to be at 3 to 4 ounces an hour before they discharge you. So you need to get your stuff together, wake up out of anesthesia, and get healthy. You know, you start off with 1 ounce, then you go to 2, and they monitor you. They give you a list of everything you get in the hospital, which is Jello, tea. You get a whole bunch of stuff in there, but it's really... you can have sugar-free ice pops. That should ease and cool your mouth as well, calm you down, because you have a lot of dry mouth during that time. So other than that, I think that's it. See if I can find a list of what they give you in the hospital. I can't remember where I put it. They give you some stuff in the hospital. You need to have your 4-ounce cups. You need to have a sippy cup. A sippy cup is very good to prevent you from gulping. And, you know, them big drinks that people like to take when they're really, really thirsty. That has air in it. So the sippy cup will teach you how to sip and let the liquid sit in your mouth and ease down instead of you just like you know, like really overdoing it. So, a sippy cup, the 4-ounce cups, and you have to have 4 ounces of protein.